It's been said that there are no atheists in foxholes. Same could have been said of an ICU or an emergency room. Times of trouble, we turn to our faith to help guide us, and those guides, not always clergy or pastors. Many of them are just like you and me, people making their way through life with experiences to share in terrible times. St. Mary's Hospital brings us this Health Minute to talk about spiritual care. We're here at St. Mary's Hospital with Karen and Chuck talking about spiritual care, and we've visited about this topic in the past. Karen, tell me a little bit about your work here at St. Mary's and what is spiritual care in the Avera system?
So within Avera St. Mary's, we have a spiritual care department which consists of a chaplain and our director. So it's two employed people, but in order to offer our response to people in need who come into our emergency room or at a time of a death in our facility, we work to have that support through our volunteer chaplain program, which offers us the ability to have 24/7 coverage for those requests or those needs that come up. So we're just at a point now of recruiting some more chaplains to join us on this journey.
Let's talk a little bit about chaplain and chaplaincy. There's a misnomer, I think, that a volunteer chaplain is an ordained minister or a member of the clergy, but we rely on volunteers. These are people that are called on a spiritual level.
Correct. These are folks from our community. We would maybe say lay people that don't have formal training. Some might. There might be a minister in town or a pastor who does want to volunteer as a chaplain. But most of our chaplains are people from our community who just feel called to this, who want to journey alongside people who are maybe in a time of crisis or a time of joy. Like we have births here and times of joy. So it's just somebody who wants to companion and journey along with people.
I think people often discover how spiritual they are and renew their faith at times of crisis and in times of great joy in their life. But I imagine you see quite a bit of that. As you mentioned, the emergency room comes to mind, but also in the delivery room.
Sure. So that is this very sacred time, new life coming into the world. So that's a place where our chaplains are called to come and to be there and offer prayer. We never force anything on anybody, and it's all faiths are very much respected, and we try to support people wherever they are and whatever they need in whatever part of our facility they're in. It could be in our long-term care facility also at Mary House.
I want to talk a little bit about the upcoming training opportunities, but let's draw Chuck into the conversation here. Chuck, I've known you for many, many years. As you mentioned, you're career retired now. Tell me a little bit about your journey before you came to be a volunteer in spiritual care.
Well, Dodie and I go back a long ways too. Dodie Nortimer is kind of the head of the chaplaincy program here. We served together at Lutheran Memorial Church on a Stephen ministry program there, got to know her really well. And she traveled from that ministry to this ministry, and so when it ended at our church, I followed her over here to become a chaplain here as the next step of things that I could do that, truthfully I didn't want to do, but sometimes facing up to your weaknesses and taking them head on like that winds up being a good thing personally as well as something good for Avera St. Mary's. So I followed her here, and it's been a very rewarding, I think 6 or 7 years I've been here working. I've really enjoyed the interaction with the people that visit and our patients here, and as Karen said, there's tragedies, there's triumphs. It's just an honor to be a part of all that.
Chuck, we're Lutherans. This is a Catholic hospital. How does that work? I'm guessing this is non-denominational.
It's very much, our approach is non-denominational. There's some that are very Catholic in their approach, and we're very respectful of that. Whatever approach they have to reach out, we're there to fulfill that. And as Karen said, if that's just not something they're comfortable with, we have no problem backing off and respecting that as well.
So what kind of training goes into becoming a spiritual care advisor and helping people in this? How does a person go about this?
So it's just really a matter of expressing some interest in the first place. So anybody maybe watching this could call our spiritual care department, talk with Dodie, as Chuck mentioned, and we could put up the phone number, right? Or ask for it if we call the main hospital number. So it's just entering into a conversation and saying, I'm interested. And to provide a group, maybe a group setting to have people feel more comfortable to express that interest in September. On September 8th and 9th, we're holding some sessions informational sessions where people who might be interested could just come. It's not mean they're making a commitment by any means, but come, have supper with us, visit with some of our current volunteer chaplains, and just learn more about it. And then if people are still interested and they want to come on Saturday morning from 8:30 to 3, we thought we'd go a little deeper and provide more information. And then as far as the actual process, is really shadowing and working with the current chaplains, doing some training with Dodie as our leader, and just kind of, it's a journey to get to that point. We want people to feel very comfortable, and we always just stress nobody's just thrown into it or left without a safety net of who to call. And we stay in good communication with our chaplains by trying to meet at least once a month just to touch base, see if they're having challenges. We also even just follow up the next day after they've been on call overnight if there's something that happened, just so they always feel supported.
And Chuck, this is I would call it a give and take relationship. There's something to give to others, but you also receive back from pastoring and being available for people at a time of need. I'm sure you can relate to that, but tell me a little bit about your experience in that area.
Well, absolutely, and I know as chaplains, that's the one thing that's consistent among us is that I think every one of us would say we get more from the program than we give. It's just part of the magic of the whole spiritual interaction that you have with people. You're giving yourself to them, but what you get back is just amazing, and that stands again with just about any interaction, whether it's a triumph or a tragedy. There's something just incredibly spiritual for just invoking the name of the Lord personally with a family or an individual like that. So to have ourselves lifted up in that way in those situations when we feel like we should be giving so much to others, you kind of leave feeling a little bit guilty, but you got a little pep in your step too. So it's kind of a magical thing, and we enjoy being a part of that.
I can imagine that the best chaplains, if we can put it in that turn of phrase, have some life experience to them. You're not looking for perfect people with perfect lives. This is about relating to people across the board.
Yeah, there is. And really, there's folks who maybe are earlier in life. We have a couple younger folks, so I didn't want to make it seem like everybody had to be retired. It's nice that we have retired folks, but there's some folks who still, and I think you were still working when you first were doing it. And so, but yes, those life experiences, and none of us are perfect, and those things, to be able to companion and journey alongside, is just being there with the person in need. And it might be a family member, not necessarily the patient or the resident.
So tell me one more time the training is, and where can they get in contact with you?
So we would just like folks, anybody interested, to call the 224-3182 and just express the interest, and we'll invite you to come on September 8th. We'll have a nice supper starting about 6 p.m. and then just go a little bit into the evening, hear from our current chaplains, because they're the best ones to tell what that experience is like, as Chuck did just now.
Karen, Chuck, thank you both for your ministry here at St. Mary's and for making yourself available. I can tell you from personal experience, I've seen lives changed when the chaplain walks in, and they really bring a level of peace to an emergency provider and staff. Yes, I know that's very important.
That I guess we haven't touched on, but the staff, there's great support for our staff here by having our chaplains present. So that's part of the whole thing, is what you do for the staff.
And the staff embraces the program too. It's wonderful to have doctors and nurses both reaching out to us when there's a need for spiritual care, and it's great all-around support for the program.
Well, thank you again, and best of luck.
Thank you.
You don't have to be ordained clergy or hold a master's in divinity, for that matter, to be spiritual care at Avera St. Mary's. We'd like to talk with you. It's an interesting program, and it can only help.